Many couples from around the world come to our facility here in Los Angeles because we've been doing egg donation and surrogacy for 20 years.
Most egg donation is done through anonymous egg donation. Very few people are able to find friends or relatives to serve as a donor, and when they can, we certainly accommodate them, and it can be a beautiful experience.
When an egg donor has not been chosen by a couple, we typically will refer to some of the top agencies in the country that are actually here locally in Los Angeles. Most couples will match with a donor based on some physical characteristics and some background characteristics.
From a physician standpoint, we want them to be successful, and so usually we will guide the parents to search for a donor that ideally is younger, ideally less than 30 years of age. Hopefully they've done the IVF or egg donation procedure before and it has yielded a pregnancy. Those are very, very strong indicators of what will happen in a subsequent cycle.
All egg donors get genetic screening, infectious disease screening, psychological screening, and most importantly, ovarian reserve screening. We will screen them here in our office with a battery of tests to make sure that the outcome as far as stimulation, retrieval, and egg and embryo quality will be at its best.
One of the keys to success for third-party parenting, either egg donors or surrogate cycles, is the synchronization of what we call the egg provider and the carrier.
When we are finally ready for the embryo transfer, we have a scenario by which the uterine lining is the most receptive. We have protocols in place to have the most optimal egg and embryo quality, and we are typically transferring 1 or 2 embryos to get a very, very high success rate among egg donation and surrogacy, anywhere between 70 to 85% per transfer.